We know how important the roles of nurses in our province and everywhere else in the country. That's why we invited the president of Philippine Nurses Association of Manitoba, Mr. Marco Pena, to talk about the struggles and barriers of the internationally educated nurses here in Manitoba. Hi Marco, kumusta?
Hello. Okay naman.
So, this is a very important topic that we are discussing today, and thank you so much for coming. So, my first question is, let's talk about your first-hand experience in getting your own accreditation. So, I believe you're still in the process right now. So, paano ka nagsimula, what year, and where are you right now?
Yes, thank you for having me here. And also to answer your question, the process for me, started in 2020. But at the same time, if you look at other individuals, iba-iba yung nagiging proseso nila. Like, may iba, tumatagal ng 3 years, may iba, 7 years, may iba, within 1 year lang pagdating nila dito. I can talk about my experience. So, when I started in 2020, the process still is not what currently is being executed by the College of Nursing. So
that was 2020. That was the pandemic.
Yes, just before the pandemic kasi ako
Okay.
nag-start. So during that time, they have you have to complete all verification checks. Kasama na doon yung magsisimula ka sa what they call NNAS. So dito sila yung nag-a-assess ng iyong education verification, kung may experience ka na ba before in the Philippines, meron ka na bang license before sa sa regulatory body, which is yung sa atin yung PRC, pati yung English testing mo.
Okay.
So before, that was the requirement, and then after NNAS, ipapasa mo ulit yung mga papeles mo. Almost the same, pero form na ng college. So, pupunta ka na sa regulatory body mo. Dito sa Manitoba, there are 3. So, yung College of Nursing for RNs, then yung College of Nursing for LPNs, and then yung sa psychiatric nurse. They would ask you the same, and then ang problem na nakakaharap during that time is that each items that they require has an expiry.
Yeah.
So may iba within 1 year, may iba 2 years. So for example, yung NNAS, nung nagpasa ka ng English testing, ang English testing is 2 years. So after 2 years, kung sakaling sumagot sila within 8 months or minsan 1 year yung result, edi may 1 year ka na lang to proceed na matapos mo yung registration mo before expiry. So yun, then there's a lot of payments. They will verify your education once the college is done with verifying their education and yung papeles mo. They would give you what is called a referral letter to undergo competency assessment. So what it involves is that you will schedule an appointment with the University of Manitoba, and then they will give you like a brochure on what to expect. Merong examination na theory related, so meaning may paper and pen exam, which is being done now through computer based. And then afterwards, you will also do kind of like a return demonstration. So it's called OSCE.
Okay.
After that, once you get the results, then they would say whether would you be taking bridging courses, or would you be undergoing NCLEX directly, yung examination na, or may iba sa kasamang palad, nire-refer nila as balik ka ng 4-year course nursing.
In your case?
So in my case, I was given a result of I have demonstrated a Canadian RN, pero since Manitoba doesn't go directly to have an NCLEX, you have to undergo 4 core courses for the nursery entry program. But at the same time, they can add up other courses depending on a lot of things. Like for example, during the OSCE, nakita nila may gaps ka dito, or tatanungin ka rin nila kung tingin mo may gusto ka bang courses na kunin pa. They would put that option in sa referral nila sa university, sorry, not university but educational institution.
Na gusto mong pasukan.
Napapasukan mo. So ngayon, we only have one place to undergo those training, which is yung Red River.
Okay.
So Red River and University of Manitoba, sila yung nag-offer ng nursing dito. So Red River was chosen to have this program specialized for nursery entry. Yun. And then afterwards, so maghihintay ka na naman for another few months or minsan depende kung kailan yung intake.
Yeah.
So I know in the past there is like a shortage of seats.
Yes.
So that's why they increased the seats to have a lot of IENs na nakatapos ng CCA, yung competency assessment, para makapag-bridging program. Yeah, so they don't call it bridging now kasi yung nursery entry program is ginagawa na siya for IENs, which is kami, at saka yung mga nawala na sa practice for more than 5 years or depende sa guidelines ng college. So, yeah.
So, ang haba, no? From 2020 to 2024 na. And isn't that frustrating for you as someone who came here, you are expecting to work in the field and knowing also na we have that big shortage of nurses? How do you feel with that?
It is frustrating kasi dumating tayo dito on the premise na the reason why they approved, the reason why Canada approved us is because of our skill level. So, so alam na ng Canada na nurse ka. So in short, they expect you to be a nurse when you get here. Pero hindi naman nasabi na may mga iba't ibang proseso kada probinsya ng Canada.
Yeah.
So may iba mas madali, may iba mas mahirap. So I know sasabihin naman nila na you should have done your research. Yes, we should have. Pero syempre may ibang barriers doon na like for example, nandito ka na. Hindi ka naman pwedeng umalis kasi you are bound to serve your to the province that sponsored you, di ba?
Yeah.
So yun.
Exactly. With all the thing that you've been going through right now to get your accreditation, what was really the most stands out to you, most challenging?
Well, financially, ang pinaka-challenged kasi when you are in school for more than 60% na nasa school ka, you are supposed to be on employment insurance.
Yeah.
So if for example nagtatrabaho ka na and your family is used to the concept na mas mataas na yung income nyo.
Yes.
Because you have built experience over the years, you have built your tenure. So pagka nabawasan ka in terms of like sa employment insurance is ang nagsasuffer is yung family.
Yeah.
So we are not given a chance to like yung magkaroon ng anong tawag dito, yung gap ng salary, di ba? So so wala namang sasagot nun kundi yung family lang.
Yeah.
So marami talagang families na may hirapan. So that's why they have put up the budget, their nursing budget during pandemic. Yung 23,000 that they were what they call this advertising. So maraming matutulungan ito, pero at the same time I don't think it's gonna be enough for everything.
I was gonna ask.
So that's why we have to look into things on how to improve the accreditation process.
Yeah, that's why this kind of topic is very important. And I know a lot of our kababayan, like I don't know anyone here that doesn't have a relative that is not nurse. And even now, we're still, as a parent, we're still pushing our children to be nurses. So this is a very welcoming topic. And so do you agree that the Manitoba has the worst accreditation process in the country?
Well, right now what I can say is that it's much better compared to like a few years ago. They have learned how to adjust a bit on the demands of our healthcare system, but compared to other provinces like Alberta, Ontario, Nova Scotia, you name it, it's much easier to be registered in those provinces. I mean, there's nothing that's being compromised in terms of like, was the education was verified? Were there any licenses? What other parameters do they need? And that's the problem as well of Canada in terms of nursing registration. It's because it's provincially facilitated. So each province will have their own way on how to do things. So, hindi kagaya sa Philippines kasi, di ba, meron tayong PRC and CHED. Yung CHED yung sa education natin. So, yung education nagdidictate na this is what we need for the education for nurses. Ito yung baseline natin. Tapos, each school will have different categories of how they can have better learning for their students. Yun. Pero ang point doon is that yung basic nursing education na mi-meet ng Philippines. So dito, iba't iba. Iba-iba yung nagdedesisyon.
So as a president of the Manitoba Philippine Nurses Association, how are you helping those nurses in the Philippines to get their accreditation? How are you supporting them?
So, yung ba yung mga dumating dito from the last
or even the
recruitment?
Existing, or yung existing muna.
So sa mga existing nurses dito na nag-start pa lang ng process, they reach out to us through the PNAM Facebook page. Sometimes we get people from Pinoy IEN, which is the whole Canada. The whole Canada.
Okay.
So yung Pinoy IE, let's start with Pinoy IEN. So Pinoy IEN is known to help out a lot of IENs na kararating pa lang, they have questions, they can search for the answers there already. I also looked into that information. That's why I have learned before na we can do bridging program in Nova Scotia, for example, or Newfoundland, Labrador.
And use it here?
And yeah, so I'm here in Manitoba. During the NNAS process, you can choose where do you want to port your paper. So halimbawa gusto mo mag-apply sa Ontario, ganun, kasi mas madali yung proseso, you can do that. So yung Pinoy IEN is really helpful to a lot of nurses like coming from Philippines. Kasi tingnan mo, yun din yung reason kung bakit nagiging mas aware or mas informed yung mga tao. So they're very helpful. So in our case, we're replicating the same thing but locally. Like we focus more on ito yung proseso dito sa Manitoba, ano ba yung may improve natin, ano pa yung currently na nangyayari, at ano yung mga possible na mangyayari. So we keep the Filipino IENs here in Manitoba aware of and informed din.
Siguro yung even yung mga new legislation coming up, changes.
Yes.
That's good. So the government of Manitoba is currently developing a new pathway for internationally trained nurses already living in the province. Do you think this will be a great support, or will this make a big difference, a little difference in the current situation we have right now?
Well, yes. Nakipagtulungan kasi ang government natin sa PNAM din. Together, we are trying to develop different pathways for each category. So, sabihin natin, may iba na within 2 years, mayroon pang experience. May iba, 15 years nang walang experience. May iba, more than 15 years nang walang experience as a nurse. So magkakaroon ng mga pathway in relation to that. But at the same time, may iba pa na, may mga iba pa mga projects ang government na in consultation or we're working together with it. Because, iba't iba ang situation ng bawat isa. So, syempre, may mga factors na may financial side, may training side, mayroon bang licensure na side na may tutulong. So, yes, it's going to be helpful para sa mga IENs na nandito kasi ang naitutulong niya sa atin is that inaahon niya yung mga Filipino IENs or not in general IENs na lang, wag na lang Filipino. Inaahon niya ang IENs sa health inequity. So meaning instead na nabubuhay tayo sa currently natin na living by means, mabibigyan tayo ng opportunity na mas mapaganda yung buhay ng family natin. So, for example, kung ikaw ay isang nurse na nagtrabaho ka as isang healthcare aide, we don't want you na makontento ka bilang isang healthcare aide. We're not saying it's bad, pero it is a domino effect kasi mangyayari is that you will talk to your kids once they are at the time where they wanted to go to college or university. And then, instead of wanting your kids to do better, accidentally pwede mo masabi na mag-healthcare aide ka na lang din kasi mabilis, kikita ka kagad. So, nawawala yung dream, nawawala yung pagkakaroon ng professional growth din ng second generation, ng mga next generation ng nurses, ng Filipino.
And also options, right? Kasi they need to know that we have options, that this is not the only way. Right? You're not saying, you're not discouraging them, but you're opening them that there's a bigger world out there that you can do. And same as, I guess, din do sa mga dumadating na even though they're not nurses, that you can still be.
And ang ano ko lang din is that suggestion lang is if you wanted to go to nursing still, make sure you still equip yourself like current trends or related pa rin sa field natin as nurses. So going back to the question about nakakatulong ba ito, ang focus kasi ng government is to help the healthcare system. It's to relieve all yung problem natin sa healthcare. Yung wait times, yung ganon, di ba? At the same time, syempre, yung budget ng government is affected. Like, federally, kung pangit ang nagiging natin sa healthcare system, lumalaki din yung gastos nila. So, that's the reason why the province or even Canada is focusing on healthcare.
So this will is this a push or an actual legislation that you are trying to work on with the present administration right now?
For the present administration, with regards to like their I think it's I cannot really say for sure, but I'm in my opinion only that it's a legislation related that is probably going to happen. At the same time, it's as an effect of that, dun mangyayari yung change.
Well, it's both, I guess, the legislation and then that legislation has to be pushed, not only in the nurses community, but all throughout the
other professions.
Kasi it would be nice to have the domino effect on all professional, diba? Not just there's the teachers also, accreditation, and many more.
Yes, exactly.
So, with what is your stand on the last year Manitoba when they have recruited nurses in the Philippines?
So our stand never changed. Actually, we appreciate that there are more Filipinos coming in, and then at the same time, they are an asset to Manitoba, not just not just not just a body that's just going to go to work.
Yeah.
They bring a lot of expertise na currently na ginagawa din sa Philippines. I mean, Filipino nurses is known worldwide as the number one producer of nurses, and not just producing but actually doing well in our field. So I was actually asked with this before kung may kailangan bang baguhin ang Philippines in terms of like sa education to be at par with Canada. And to be honest, I would answer it all over again the same way. Like, I will not change anything about the nursing culture and nursing education in the Philippines. I'm proud that I'm a Filipino nurse. It's because it has taught me a lot on how to deal things, how to make things better for a lot of patients. Then it's just a matter of how you execute it and how you remember it. Then
so going back to that question, so I mean, do you agree with that or with that move, or would it have been better in any other recommendation that you could have recommended if you were in that position? Does this move gonna help tremendously the current situation, or are we causing more problem?
So it's a hard question to be honest, because I mean there are a number of nurses here already. Like I don't know the exact number now because during that time ang data lang is up from 10 to 12 to 2020, probably 2020. There are at least 1,800 nurses that are
in the province.
In the province, na wala pang license.
License, okay.
And then at the
18,000.
1,800.
1,800.
Yeah.
Okay.
And then in 2022, yun din ang result ng survey.
Okay. So
it's still the same. So
okay.
I'm not sure where does that stand right now. Pero just to think of, like, if it's more than 100, I think we still have 100 people na pwede mag-work as a nurse, di ba?
Yeah.
And given the fact na the services, we have 1,800.
Yeah.
We have 1,800 nurses to fill vacancies. If we could have been accredited sooner.
Yeah.
Diba? Yeah. So, in terms of like, sa question mo, the reason why mahirap siya kasi, una sa lahat, yung mga nurse na darating din, may current experience.
Yes.
Yung nurses na nandito is, sabihin natin, may gaps na rin.
Yeah.
And I do not see the problem with that so much gaps kasi kung meron kang strong foundation in the past, meron kang educational system dito na magsusupport to learn for us to be able to like translate what our knowledge in Philippines to Canadian way of nursing, then madali ka makakabalik sa nursing.
So there should not be any issues and not to prolong it for
yes, exactly.
years.
I mean, ang basis nila is kung ang basis nila is exam, like for example yung competency assessment, we can surely pass it if we know how it should be treated as, like how to answer it. Like it would be easier. So yun.
Yeah. So what else do you think can be improved? Like, I know there's so much, but on your opinion, like what stands out to you? Na pag ito nawala, itong process na to, I think it will help. Because I know it's overwhelming right now. But I was thinking lang, if we take it step by step, and if there only be one now you can focus on, and ito ay may remove or at least maging easier, then medyo bearable yung current na rules ngayon in the accreditation. What do you think would that be?
Well, comparing to other countries na lang, other countries, they almost have the same pattern, like meron tayong education piece. I-assess yun for sure. Pero may mga best practice. So an example is that for Alberta, in yung registered nurses college in Alberta, they would call someone and say, is this person really from a reputable school type of thing, ganun? Or is this person really verified?
Yeah.
They do it themselves, like actual, like marami na rin ngayon, like marami ng online din eh. So pwede mong i-search, like may nurse verification na yung PRC.
So parang maraming redundant na
steps. So sabihin natin, yes, NNAS will have the database and all. Bakit hindi na lang nila yun na lang agad? For education piece, NNAS na lang ganun. Sa English naman is that mahirap sagutin. Ang reason is because although Philippines is now bilingual, like Tagalog and then English na talaga yung language natin. And to be honest, we grew up speaking English.
Yes.
Like from the time of when we started talking, it's English already. And then at the same time going to school, the curriculum's English and all. So it's actually it makes sense that Filipinos would be able to adapt well in an English setting, English speaking setting. So
those
that
two,
part could be slashed off. Pero I'm not saying that everyone is the same, like everyone can speak the same language. What I'm saying is that let us be able to get like the scoring of what a regular Canadian can speak.
Okay.
Because I mean, like the English testing scores that they required before the change is not how Canadians speak. So there are a bunch of research from University of Manitoba or even in other provinces that would say that a Canadian nurse is not speaking the way that you are requiring them to be. So and yun lang. Doon pa lang alam mo na kasi local grads na yun. Dito na yung lumaki. Dito na yung nag-aral. Then why can't they reach the same scores that you require IENs?
So that makes sense, no? Kapag pag inisa-isa mo siya, it's everything is going back to one issue.
Yes.
Diba? Parang dugtong-dugtong siya, pero I don't know. It's like a base. That's why I said to you earlier, like I think we're gonna run out of our time if we discuss all the details. How challenging it is to get your accreditation. But since we're still on this, we'll feature that in our next episode. So abangan po ninyo yan. So with the what else is there? Since there's no other nurses association, so do you accept Filipino member?
So right now we entertain other nationalities, but not as a member nga lang. Kasi may ibang benefits ang pagiging member ng association. Like mas marami silang knowledge na nakukuha. Although we share our knowledge to other IENs to may pagka nagtatanong sila na ganito ba yung proseso dito, ganito ba yung ano yung dapat kong gawin, suggestion mo ba dapat ganito, pumasok ako sa ganitong hospital, ganyan. We cannot say anything against those institutions, di ba? Pero we try our best to like answer their questions like, ito yung processes. Ito, papakita ko rin sa iyo yung sa website ng CRNM, for example. So, at the same time, ano ba yung mga kailangan mo na nahihirapan ka? So, kung nahihirapan ka sa nawala na yung confidence mo dahil matagal ka nang hindi nagpa-practice, so saan ka pupunta dapat? So, mayroong mga institution na ganito that you can self-learn. Tandaan mo, may sarili kang, kung naging nurse ka na dito, minsan nurse na nga sila. Kung nurse ka na dito ngayon, you have the responsibility to make sure that your patients are safe, di ba? So hindi dapat magsa-stop na okay, nurse na ako,
Yes.
tatrabaho na ako, kikita lang ako. Hindi siya ganon. Ang pagiging nurse anywhere in the world is a privilege and a responsibility.
Exactly.
Privilege ka kasi you are being given that role na you're being trusted by an individual of your expertise.
Yeah.
Di ba? Kaya meron ka responsibilidad to do good and not to do harm to people. Sabi nga dun sa ano na lang, share ko na lang ng konti sa Bible, di ba?
Yeah.
God ordained us to take care of our neighbors. So, and especially yung mga may illness and yung in need.
Yeah.
And you cannot do your job as a nurse to properly take care of someone kung ganito, kulang yung ano mo, knowledge mo.
Knowledge and also your heart have to be in the right place
Yes.
to do it. Diba?
Yes.
Part ba yun din ng organization, not only to assist in yung mga documents and education? Is there also like a mental support?
Wala kaming mental support, pero syempre support group na rin kami. Pero at the same time, in the past, maraming activities ang PNAM. Ngayon kasi ang focus is malaki sa accreditation ng IELTS. Pero ang PNAM is not just place for accreditation questions. It's for education of nurses too.
Yes.
At the same time, sa public, we also do, we have also done past tense, yung mga in the Filipino community where we teach yung diabetes education, things like that.
So may mga outside activities kayo.
Yes.
That's
So
great.
and currently right now ang maraming focus ang PNAM in terms of like sabi mo nga pathway.
Yes.
Pero at the same time how to improve others too. So we are building a network din ng nursing associations across Canada on how to like have better mentorship for IENs. And at the same time, like, ano ba yung best practices dito? Marami kasing talent ang Filipino nurses.
Yeah.
May iba sa infection control, may iba sa investigation research, may iba sa nursing management, etc. May mga educators din tayo.
Talaga. Wow, that's so big, right? And your responsibility as a president, medyo overwhelming, ha?
It's voluntary. All our yung nasa PNAM they are volunteers. We are volunteers. We don't get anything in return in terms of like how like earnings or pero ang pinaka mabigat kasi sa part ng nursing through PNAM is that we wanted to empower everyone, not to give up. We're trying to give hope to all IENs, especially our mga Kapinoy.
Yeah.
So and the reason is because I mean you are special. As an IEN, you bring a lot to the table. We believe in you. Stay focused and then just wag tayong mag-shortcut lang na oo, magiging license tayo pero we want you to be safe as well kasi mahirap na sabihin ng iba na ay hindi ka safe. Doon nagsisimula kasi yung stereotype eh.
Yeah.
So,
and also of course, you have to take care of yourself, diba? Especially with the variants that is around right now. But yeah, this is a big topic that I don't think can be covered for one sitting. So, but I really appreciate you coming here, Marco.
Sure.
Maraming salamat. And I think a portion of what we are aware of about the challenges, because we know the challenges, pero we just didn't know how much. Grabe pala. So, but this will hopefully that legislation will come through, will push through, and will really help us, the community, to help our kababayan to get that, and also help our province to have more nurses,
Yes.
right? So maraming salamat sa panonood po ng Mabuhay TV here at U Multicultural Channel. And we'll see you again for another informative and yet very important topic dito lang sa Mabuhay TV.